This lecture is going to be very conversation-based. It's set to be an evening for sharing wisdom, experience, and knowledge. A lecture in which two doctors will come together to share all they've learned over their careers and provide a true glimpse into family medicine and pregnancy care. Let's begin. First up is Dr. Jane Pritchard. She is a family medicine physician in Toronto, but she has worked all over the world, including Australia and Bangladesh, where she experienced firsthand the medical consequences of poverty and injustice. In Toronto, she has worked extensively with Latin American refugees and marginally housed people. Now, I don't want to elaborate too much on her experiences, as I know Dr. Pritchard has her own presentation ready. So I'll hand it over to her to learn more. Dr. Pritchard?
Thanks, Zoe. And thank you all for lending an ear to my reflections on journeying with women through pregnancy. I should explain that prenatal obstetric care and postnatal care of mother and child have been my role in this regard. And I retired 3 weeks ago from my busy family practice, and I'm still in withdrawal. Actually, this past weekend, I attended the 50th anniversary of my graduation from Queen's University Medical School, surrounded by barely recognizable elderly people wearing lanyards with their photos from 1973 around our necks. Where did the time go was the question on everyone's lips. Well, as you know, as medical and nursing students, the time went in a frenzy of lectures, labs, exams, practicing on patients, not sleeping much, running on adrenaline and caffeine, feeling alternately fascination and terror. It was good training for parenthood. By way of introduction, I'm married to Doug, an engineer by training, and we have 3 sons and 6 grandchildren. I'm the only physician in my family. I knew I wanted this vocation from the age of 11. Family medicine residencies were a new option when I graduated, and so I chose that now much needed field. Wanting to see some of the world, we left for 2 years in Australia, which turned into 12 with a 3-year hiatus in Bangladesh, which opened my eyes in a new way to the needs and inequities of the world. We came to Toronto to be nearer aging parents. This was in 1987, and I found opportunities to work with families fleeing civil war in Central America. At the same time, I found work with homeless women downtown, not having realized there was such urban poverty here in Canadian cities. In this context, I came to journey with some women during their pregnancies. Here are some stories. She had had 3 children and found herself pregnant again. She was a refugee from the Civil War in Central America. She had been forced to see what no one should ever see. Her much older husband had protected her there, but was abusive here. She felt she had no option but to terminate this pregnancy, though she felt that that was wrong. I can't recall what I said, but mostly I listened. That son is now in his late 20s, and he checks in on his mother regularly. What she witnessed still haunts her, and she fears she is being followed by strangers who mean to harm her. She is a grandmother now, and spending time with her toddlers gives her great joy. She feels completely accepted by them and at ease with them. Sometimes there are conflicts with her children, and she withdraws for a while. She doesn't want to meddle or lose access to those grandchildren. You know, when someone comes and asks for an abortion and that doesn't happen, it almost seems after the fact as though you had no role in that. It's really hard for me to say if I had a role in that, but you know, I guess the fact of the child, and then the child growing through, you know, through childhood to adolescence to being an adult himself, it seems as though his life was always inevitable. But of course, there was a decision point. Another story. She was a student activist in a sub-Saharan country working for a more just society. She had a happy and secure childhood and had just recently married. In the civil unrest that ensued, her new husband was assassinated. She fled for her life to another country, but found she was pregnant. She said she was an emotional wreck, and the women who helped her there were kind and compassionate and insisted she terminate the pregnancy, and she agreed. She was granted refugee status in Canada and came to Toronto. She fell into a deep depression that had many root causes given the number of friends and family members who had been murdered. She regretted her decision to terminate the pregnancy. She felt that she had been pressured into it, that it was not her true desire. When she felt emotionally well enough, she would volunteer in shelters, reaching out to women she could help. But often, dark thoughts would overcome her. She isolates herself, resists human help. She grows plants of all kinds in a community garden. She decided she could never be a parent, as she feels she can barely look after herself. I can't trust people, she told me. I can't let anyone get close to me. So she keeps to herself, except when she is gardening. Then she exults over those living shoots she can plant and harvest, and gives the produce away with a wide smile. She is an artist too, and her starkly beautiful painting hangs in my examining room. She's in her 50s now. When I was a medical student, I was 23, 24, 25 at the time. If a 30-year-old woman got pregnant for the first time, she was considered an elderly prima gravida with many attendant risks. Well, I have some stories from the past year of older mothers, but I don't think that the 30-year-olds of 2023 are in the same bad shape as the 30-year-olds of 1973. She was 38, a successful corporate employee, and she and her partner had decided they would not have children. I would not make a good mother, she told me. She was on oral contraceptives and never missed a day. She had come to me because of mounting anxiety that was causing tachycardia with a heart rate of 180. She no longer had benefits for counseling, so that option was closed to handle her anxiety. Without her telling me, I knew some of the backstory. She was also a refugee. One sibling, who was my patient, had survived a kidnapping that resulted in multiple suicide attempts over many years. Thankfully, unsuccessful. Her mother suffers from a serious heart condition triggered by anxiety, of which she has had more than her share in her life. My patient panicked when her period was 4 days late and the urine HCG was positive 3 times. She had not slept for 2 nights. She was afraid to tell her husband, but she said, "Now that I am pregnant, I must have this baby." She knew her mother would be supportive. She lamented the fact that she would need looking after, as she has always been the one to care for her mother. She did not want to resume the antidepressant lest it affect the baby, so has been enduring and managing the inevitable anxiety that occurs while awaiting results of prenatal screening and each ultrasound. She's entering her 3rd trimester now. Accompanying a woman through pregnancy can mean accompanying her through the grief of fetal loss. One woman with hypertension and morbid obesity conceived after IVF, but lost the baby at 5 months due to cervical incompetence causing premature labor. She lost a lot of blood in the process. She was grieving for months. This was during COVID, and we connected by phone. She wanted to talk. Sometimes the informality of a relationship with a family physician over the phone, when you don't actually have to look at someone, is easier to an easier venue to express your feelings. We talked repeatedly. 2 years on, she's again pregnant, on bed rest at about 6 months gestation now. When I see a patient who is newly pregnant, I'm frankly often apprehensive about whether she will be requesting abortion. I understand such a patient is in a vulnerable position with their healthcare provider. They may not know that I am pro-life. As I see it, I cannot be complicit in ending a life. For those who opt for abortion, I try to offer a non-judgmental follow-up plan to ensure their safe recovery. Some women take me up on this, and some do not, and some never return. Young women face such trauma that I have learned to set aside how I feel about abortion, to listen to their stories. The volatile young woman who has had 2 or 3 abortions has likely suffered sexual abuse at a young age, often by a family member or friend. She may not speak of it for 20 years, if at all. A woman who has had these experiences, known to me, with chronic anxiety, became pregnant at age 38 and came to me determined to keep this baby. But because of her chronic anxiety, she was terrified of obstetrical visits and testing and the uncertainty of knowing the result of this test and that test. If there was anything wrong with this baby, she said she didn't want to know, and she didn't want to talk about it further. So we had a kind of a hands-off antenatal care until, of course, she got transferred to the obstetrician who cooperated with her plan. She agreed to get an anatomical ultrasound and the usual blood tests, and the ultrasound was normal. The pregnancy was uneventful, but her baby proved to have pervasive developmental delay. 3 years later, she was pregnant again. The same hands-off antenatal care as before, normal delivery. The second baby has autism. To see this woman's calm, laser-focused consoling of these fragile children when they are distraught moves me close to tears. And now this courageous mother is battling cancer. And I know the drive to provide for her children is what keeps her going every day. She's actually on palliative care. At Evergreen Health Center for street-involved youth, we see teenage moms, their partners, and their babies. It's my experience that when teenagers are homeless or marginally housed, there's often a history of abuse that has made life at home untenable. Emotions run high, excitement beckons, romantic relationships ensue, and so do pregnancies. Many of these young women crave that unconditional love that a baby provides. They are often very diligent in their antenatal care and bring their babies dutifully for all vaccinations and well baby checks. Life gets more chaotic at the toddler stage, and sometimes there is another baby on the way. This center is for 16 to 25-year-olds, so I don't get to see how life turns out for those mothers and their babies at, say, the 10-year mark. But during the time they attend, every effort is made to help the mothers and fathers with their literacy skills and job searches. Resourcing the young parents is the best way to help them become self-sufficient and have healthy relationships. But if emerging mental illness or substance abuse is in evidence, then of course the child's safety is paramount. But I've seen many young mothers get off drugs as soon as they learn they are pregnant, against all odds, having tried and failed before. More difficult is after the euphoria of delivery, back to the grinding reality of attending to a baby's constant needs, when the urge and opportunity to use can return. Life is difficult for these young parents and their children. Just one last comment on postpartum care in the community. In many cultures, it is the custom for new mothers to rest, sometimes entirely at home, for 40 days postpartum. Certain foods are encouraged for lactation. Usually female family members come and stay and help. Now, I would like to be able to write a prescription for this in our society. In our frenetic culture, more thought is given to getting right back to your day job as opposed to the 24/7 job of caring for a newborn, losing all the weight you gained, resuming your workout routine ASAP. I'm sure there is a way to make dads and brothers comfortable with this program as well. I might add, if anybody ever gave it, I did not follow this particular advice myself. Well, back to you, Zoe.
Thank you, Dr. Pritchard. And first, congratulations on your retirement. And thank you for allowing us the opportunity to listen, to repeat what you said, to listen to these deeply personal stories of struggle and fear, but also beauty and overwhelming hope. So thank you for that. And next we have Dr. Deborah Zeni, who is a family physician in Georgetown, Ontario, and so much more. She is also a theologian, an educator, and a preacher. Dr. Zeni shares a family practice with her husband, Dr. Paul Zeni, and together they provide medical care for all ages, including prenatal care and palliative care. Dr. Zeni, I'll turn it over to you now. Oh, you're muted. There you go.
Thank you very much, Zoe, and thank you for all who are attending. It is truly a privilege in the best sense to be here with you to share these stories, to hear Jane's stories with her patients and their stories. And it's a privilege for me to be able to share some of the stories which I've had with you. Privilege awards us with opportunities to thrive. And when I share these stories, there is joy, as Zoe mentioned, and there's also heartache, as we heard from Jane. When we practice medicine in a life-affirming way, there is an alternative to practice medicine in the way that a lot of people are taught, that there's rules and regulations, there's cookbooks, there's things you say, there's things you don't say. And certainly the college is very directive about telling us as medical students and also as instructors of family practice residents that we're not supposed to get emotionally involved with our patients. We're not supposed to give them our opinions. And for God's sake, don't let our own wisdom impact their decision-making. And frankly, I don't believe that at all. I think when we do life-affirming care, what we're doing is we're sharing in the lives of our patients. And that sharing, we take on a responsibility. It means that we don't just dump on our patients, our women who have pregnancies, the responsibility of making choices for themselves or on them and their partners. We become part of a decision-making group, and we share both the responsibility and the accountability for the decisions which are made. And sometimes this is very tough. I had a lot of help, though, along the way in showing me how, and people, my mentors showing me, physicians who I worked with showing me how we really can be generous and life-affirming as we care for our patients. And I'd like to start off with the story of myself. I know in this day and age, and back when I was young and starting a family, the majority of women, because of the accessibility of birth control, have planned pregnancies. And then there's some of us who don't have planned pregnancies. And when in 1 week I managed to finish my exams from medical school and graduate and get married and leave home for the first time and start my internship program, I also got pregnant. And believe me, it wasn't expected, it wasn't planned. And the response of my colleagues was surprisingly negative. They didn't want to cover call for me. And I was told bluntly by a number of them that the most responsible thing that I could do was have an abortion. At that time, I was working in a Catholic hospital. And I can remember being on an elevator when one of my colleagues said that to me. She said, really, you're being totally selfish in carrying this pregnancy through. Think of the rest of us and what we will have to do to cover for you. And I found my voice. I didn't even know I had it. And I put my hands over my belly and I said, this is our baby. And we will work as hard as we can not to inconvenience you. And I would appreciate as much help as you can as we continue our pregnancy and we take care of our little baby. Well, in the old days, they used to have pictures of all the graduating internship groups all along the board on Bond Street, at the Bond Street entrance. There's one picture which is distinct. It's got a baby carriage right in the front, and that's our first son. And he's been a true delight to us, as well as all our other 4 who got there. But what got me through the pregnancy more than anything else was the comments made by my obstetrician on the first visit to see him. And I made comments like, I can't believe I got into this trouble. I can't believe I was so stupid to get pregnant. And I said, this is a real mess. I don't know how I'm going to cope. I don't know what to do with this. And he paused, like he was a busy obstetrician. And I knew him because I'd worked with him for over a year before I went in to see him as a patient. And he drew up a chair and he sat down. And he held me with his eyes. And he said, Debbie, no more of this. This pregnancy is gift. The baby you are having is gift. And he just sat there with me with those words. Understanding new life in utero to be gift, having that validation from my obstetrician made all the difference to how I carried on that pregnancy. I carried it on with joy, with hope, and with that constant feeling within me that I was living gift. And we were recipients of gift in the truest sense. So if you spin ahead a whole bunch of years, I was working Emerge one day, and by this time we'd had 4 kids, and I was still working Emerge, as well as doing obstetrics and pediatric consulting work. And in came this lady who was much older than I was, like early 50s, with a complaint of abdominal pain and increasing abdominal girth, or an abdominal mass, as we would call it. So when I went in to see her, I realized that the pain was coming and going. And I said, have you had this pain for very long? She said, oh yeah, for about 6 hours, and it's just getting worse and worse. That's why I had to come to the hospital. And I said, what do you think's going on? As I looked at her belly, and I saw this sort of shift in her belly when she was getting this pain. And she said, I think I have the worst tumor ever. And I said, really? She said, yes, I've been to the doctor, almost every other week for the last 7 months, complaining that I'm getting bigger and bigger and bigger. If I didn't know better, I'd say I was pregnant. I actually told him that one time. And he said, no, of course not. I was just in my menopause and I was getting fat. But this isn't fat, and this is pain. And I said, well, why don't we just take a look for a minute? Do you mind if I just examine you? So I examined her belly. Yep, there was the bottom. There were the small parts. Down there was the head, way down on the pelvis. And I said, I'm going to just listen to this tumor you have. And she looked at me a little bit odd. And I got the dot tone out. And she heard the heartbeat of her tumor and burst out into tears. and the biggest grin. She said, I knew I was pregnant. And I said, yeah, and you're in labor, and I would imagine you're going to have a baby very shortly. And all of a sudden, her face froze in horror. And I said, what's the problem? She said, how am I going to tell my husband? And I looked at her and I said, well, all depends on whether this baby is your husband's, doesn't it? And she laughed. And she said, of course it's my husband's. Who else would it be? Well, I wasn't going to say anything because I didn't really know her that well. Anyways, I knew her from the community, but I really didn't know her. I actually knew her older sons. The youngest of her 4 sons was 17. And this is what her problem was. And so I said to her in the same way George had said to me many years before that, tell him you're receiving gift, that this is all gift. And she had a healthy baby girl about an hour and a half later. And then I was in Loblaws pushing my cart in the vegetable section, as I remember it. And about 3 years later, this toddler came up with her pigtails flapping. And she grabbed my legs and she looked up and she said, Mommy says to say I'm the most special and the bestest of gifts. And she just wants me to let you know that. It was a great ending to a story. However, as you know, and as you've heard from Jane, that's not the way it is most of the time with unplanned pregnancies, or a lot of the time with unplanned pregnancies. Most of the women I see who get pregnant without planning it are scared. They've got other plans in their lives, whether that's to get a job or to not have any more kids because they have so many at home, or a career which they're launching, or school which they have to finish. And I remember when Martha asked me to talk about this, I had just got off the phone when Martha finished to a young woman who's very, very bright, very, very, very pretty, and had a very troubled childhood. As Jane said, women who end up without family sometimes are those whose family was abusive. And she had experienced the abuse, and she became anorexic, and we took care of her through her anorexia. And the family mended, and the abusive behavior stopped after some good intercession and good counseling and support. Again, they were immigrant family with no resources. Once the resources were put in place, once they got some friends and some support from the community around them, they managed so much better. And so she went on and she went to one of our universities, an elite program in one of the universities. But during her years in high school, she had been sexually abused by a young man who was a couple of years ahead of her. And after this had happened, I had to go to the school superintendent for appeal to get her transferred into a school where she would be safe. However, when she went to university, somehow this young man found her and pulled her into a very dysfunctional, abusive relationship. And for those of you who have dealt with abusive relationships and women who are in them, there's a way that they find it very difficult to get out. They get enmeshed in a codependent relationship where they feel responsible for looking after their abuser. And she got pregnant. He raped her, she got pregnant, and she felt, as a very devout Catholic, that she needed to be family and form a firm relationship with this guy. Of course, the abuse increased during her pregnancy, so we managed to get her back to her family, who were more than willing to take care of her. She had the baby, but again, because it was his baby, she had to have visitation, and gradually over the intervening year, He again raped her. She again got pregnant and again decided to carry the baby to term and deliver the baby. She kept knowledge of the pregnancy from him until she was almost 8 months along. And then somebody told on her and he beat her up again. So once again, CAS was called in to protect the family and it was separated. But once again, after the birth of the baby, he got back into the picture because there was no restraining order against him. And he was the father of the child. 2 children at this point. I see this as, in many ways, a failure of our society to protect our young women, a failure of our society to not label abuse for what it is, when it's subtle, when it's verbal, to not label unwanted intercourse as rape when they're in a relationship. I see us being responsible in some ways because we don't take care of our immigrant families and support them the way we would support our own families. And they get the short end of the stick because of racism and the old colonialism, which still reigns in our school systems. And I think a lot of people have failed this young woman. Some of the people who have not failed her, I'm pleased to say, are the CAS workers. And one of these workers has just gone to town for her. And I'm really happy to say she's back at university. She's finishing her 4th year major degree. She's on a road to becoming a very, very strong, capable mother who will be a credit to our system and who will be working in the field of education and economics, making lives better for people like her parents and families like her own. So there are good endings, but it takes, you know how they say it takes a village to raise a child. It takes all of us working together as a team, willing to put ourselves out and going the extra mile so that these women who find themselves with unplanned pregnancies in poor situations can get help. There's another woman in my practice who I've known ever since she was a young teenager. When she got pregnant at the age of 15, that's a very young age to get pregnant. You know what I was doing? I still have my Barbie dolls out when I was 15. Anyways, she got pregnant at the age of 15. Her parents, again, devout in their faith, were appalled that she'd had intercourse prior to getting married and suggested that in her best interest she have an abortion. When she didn't say yes to the abortion, her parents then kicked her out of the house. And I was really surprised. So she was homeless and she was alone because her boyfriend ghosted her as well. Somehow, Lee had the courage and the guts to not only have her baby, finish her schooling, and reconcile with her family. And I asked her years later when we were talking about this, why she didn't have an abortion and just give up when everything seemed to be against her. And she did this, she put her hand on her belly, you know, like the child was about 16 when I talked to her about this. And she said, well, he belonged to me and I belonged to him. We belong together. And the reason why I reconciled with my family is because I wanted him to belong to my family. She's now married. She married a childhood sweetheart who had been present with her through all of this. And he, of course, adopted the baby shortly after they were married. And this was when he was 2 or 3. And the young man has grown up thinking of his adopted father, his stepfather, as his real father. And they do, they belong to each other and they support each other. And they make family work despite the problems which they had early on. Not everything ends so happily. There was another young woman, I'll call her Michelle, and she was a bit of a wild kid. Like, believe me, there were 7 kids in the family. She was smack dab in the middle. And, you know, like somehow with middle children, I was a middle child, so I can say this. They sort of get away with doing all sorts of things, which the oldest and the youngest don't get to do. And she sold lots of wild oats, and she too managed to, and she too became pregnant when she was in her teenage years. She was horrified that her parents would find out. And she was really ashamed of getting pregnant. And so she went and she had an abortion. And the only person who knew about it was myself and maybe 2 good close friends of hers. Her family never found out. Or at least she thought her family never found out. And she got married. And she came to me after she was married and she said, it's been 2 years. I've been married for 2 years. We haven't used any form of birth control. I am so afraid I will never get pregnant because I'm being punished for having an abortion. I was appalled. I was thinking, oh my God, how were we taught this sort of morality to children, to teenagers? And I said, no, God would never do this to you. God does not punish people for making mistakes. And that's what your choice to have an abortion was. And she said, yeah, but everybody else judges it as a sin. And I said, no, it was a decision that you made. It was what you thought was the best decision when you made it. It wasn't the decision I would want for you. And now I think you're thinking it wasn't the best decision for you. And she said, no, I would have been much better off going on and having this pregnancy. And I said, yeah. So what's the biggest job that you've got to do right now? And she looked at me and I said, God's forgiven you. He forgave you before you even thought about it. I said, so who needs to do some work? And she looked at me and she started to cry and she says, I don't think I can ever forgive myself. And I said, on your own, probably not. However, with the love of your husband, the love of your family, because she came from a very, very loving family. And I said, and the love of God, because she was a very spiritual young woman. You will have the courage to forgive yourself. And I said, a bit of counseling would really go a long way to help you. So we got her into counseling. And the counseling helped, the prayers helped, the love worked its everlasting creative wonders. And when she got worked up, we did find out that she had had PID, it's pelvic inflammatory disease, so she did have scarring. And one of the reasons why she wasn't getting pregnant is because of the scarring in her pelvis. So she had IVF, even though it wasn't something which would have been normally accepted within her faith tradition. And she has 2 lovely children, very successful pregnancies. And she feels grateful every minute of the day for what she has. So there are complications to abortions. As Jane mentioned, a lot of women get depression. They find it difficult to accept what's happened and what they've done. They feel ashamed of having abortions. And yet there's life out there. And it's our job to be as life affirming with women who choose abortion when they have an unplanned pregnancy as it is when we choose pregnancies. And I wanted to leave some time for questions and discussion. However, I have one other thing which I want to share with you, because it really turned my eyes to and my heart in a way which I thought by the time I'd been in practice for 30 years and I taught medical students and I delivered hundreds and hundreds of babies, that I pretty well had learned what I had to learn about obstetrics and about women who cared for women. And then I went over to Uganda. And healthcare in Uganda for women in certain parts of Uganda is excellent because of the efforts of an obstetrician from McMaster University who went over to Uganda and single-handedly browbeat the medical schools and the politicians and the finance people and the people who own big businesses to do something to make pregnancy and labor and delivery safe for the women in Uganda. Uganda at that time was ravaged by HIV. The women were often dying after they had their babies. They were leaving families of orphans behind. And the wife of the president was open to the life-affirming message of the obstetrician who went over there. And so in some parts of Uganda, there was good care. Where we were out in the Rwenzori Mountains, right up by the Congo border, where they were still getting raids by the rebels, and people didn't have the luxury of having good maternal care. They had midwives, which might have had maybe 6 to 10 hours of training and had very few resources at hand, certainly didn't have access to sterile equipment, didn't have access to ambulances, certainly didn't have access to emergency departments and transfusions, blood supplies, or medication. So what we were seeing in clinic and what we were receiving were women who were coming in who were hemorrhaging, who were in obstructed labor, babies who were dying because they had been born in extremis, and mothers who were dying because they were hemorrhaging after deliveries. So I was appalled, and I was very fortunate to have with me a midwife and a nurse practitioner who had done lots of obstetrics and family planning care. So between the three of us, along with my husband, who loves doing obstetrics, which is the only reason why I ever got into it, we decided that we would hold a workshop for women, and we would answer their questions about what they wanted to do. We would listen to their concerns first, and then we would try and help them problem solve around their concerns for their women. And we started early in the morning. And early in Uganda is early, it's after sunrise. So it was about 7 o'clock when all the women started arriving. We promised to feed them, and that always brings out lots of people, but they came, and they came in droves. And we had at least 40 midwives, 40 to 50 midwives. So we sat around in this sheltered area, and for the first hour to 2 hours, we just listened. We listened to them talk about all the disasters they had as they were caring for pregnant women. And then they started asking us questions. Well, what would you do? What do you do in North America? What do you do in Toronto? And I would say, and I prefaced the whole start of the two-way conversation as saying, it is not going to be possible for you to do what we do in Toronto here because you lack resources. We're going to have to think together and plan together about what you can do with the resources that you have. And how are we going to do that? We worked all through lunch. We worked through the early afternoon. We worked until the late afternoon. They had to go home by 4 o'clock. Otherwise, they'd be going home in the dark, which was dangerous. So we called a halt. They had all sorts of good information. They practiced on one another. We gave them templates for care. We handed out, we planned to get them access to a drug called prostaglandin so that they would be, and another medication which would contract down uteruses, which they could give. And we taught them simple procedures which would make a difference. We taught them the importance of recognizing high-risk pregnancies so that the women could be transported to somewhere where they could be cared for properly so they didn't end up with obstructed labor. We talked to them about third stage delivery care. It was amazing how receptive they were, how eager they were to learn. Anyways, they came up at the end and they sang a song for us and they danced to us. And then I asked them, what were they most grateful for? And I was thinking that they were going to say, oh, this piece of information or that piece of information. And the leader stood up and she knelt before me and I felt so small. And she said, we thank you. We are so thankful for what you have given us. Is a feeling that things will go better in the time which is to come. Do you have a word for that? And I said, yes. The word for the feeling that things are going to be better in the time which is to come is hope. And they sang the word hope. It was a new word in their vocabulary. And a year later, we went back and all the plans which we didn't implement, they implemented it. The birth rate went down because they knew a bit more about family planning. The baby survival rate went way up and the maternal death rate had plummeted. We hadn't built any clinics. We just provided resources. And the most powerful of anything, we provided them with hope through education. So that's where I want to stop.
Dr. Zeni, thank you for taking us on a journey of going against the taught do's and don'ts to instead offer patients the privilege of true life-affirming care and exemplifying what it means to really sit and listen and speak with your patients. Thank you for letting us have a glimpse of that. Now we're going to move into the next part of the lecture, which is the discussion portion. And we're going to ask the two doctors some questions that hopefully they'll be able to answer together and go back and forth on. Martha Crean is with us here, and she's the president of the deVeber Institute, and she would like to ask the first question. So,
hi, Dr. Jane, and hi, Dr. Deb, and hi, everyone who's listening today. Thank you for being here and together. This is so rich, so rich. So this is going to be a question wrapped up in a couple of stories. Okay, so first, pregnancy is 9 months. I think we who've been pregnant often say pregnancy is 9 months just so you can get totally used to this and go through every emotion that there is before the baby is born. There's a reason pregnancy is 9 months. But we all know that the beginning of pregnancy is often the time when the mother is most vulnerable to many things, including the reaction of others and her own decision-making about proceeding or not proceeding with the pregnancy. So what she hears at the beginning is often crucial. I'll give a short story. When I was pregnant for the first time in 1975, and I was working in a group home with young children, I informed my manager, who worked every day in the house with me, that I was pregnant. And I got a reaction I never expected, which I thought wasn't the best reaction to hear. And he said, "Oh, now you've got a few decisions to make, don't you?" That kind of set me back, as maybe this isn't the best thing to hear when you've just told somebody something so deeply personal and important as that. Fast forward many years later, I have the privilege of working with refugee adults and immigrants in Toronto. And in that position, just like a doctor, I am privileged to hear many things that are often of a deeply personal nature. And so probably very early on in pregnancy, I would hear from women that they were pregnant. And I remember a couple in particular. One was a woman from the Middle East, a very hardworking mother of 3 children. Her husband worked long, long hours to try to provide for the family. Having come to Canada had been traumatic and difficult, but they were here and they were, trying to catch their breath. And she found out she was pregnant with her 4th pregnancy. And she just said, "I can't deal with this. I can't possibly deal with this." And so I tried to talk with her and just suggest ways of support and kind of confirmation of what a great mom she was, but listening to her. And then I realized, this isn't what she needs, when she told me that she'd been to her family doctor, who knew her really well, who had said, "How do you feel?" And she said, "I don't want to be pregnant." And so she left the room. The doctor came back, had an appointment written down for an abortion in Toronto for about 8 days later. And so she told me that. And so I listened and I said, "Well, would you do me one favor? Would you go to one more doctor? You've been to one doctor. Would you go to one more? Because this is a big, big decision." And she said, "Yes, if it's somebody you recommend, I will." And so there was a doctor who I knew in a downtown Toronto hospital who'd always said, "Any student you have who's in need, send them to me. I'll try to take them right away and listen to them and see." So I referred her to him. So this same woman went to a different doctor, same feeling, but he sat down with her. He had 4 children, and they got talking, about being parents, and they got laughing, and they talked about how we could get through this pregnancy. If we were going to keep it, how could we do it? She came out and she told me the next day, "I ripped up the appointment for the abortion. I don't need to do that." What do you say as doctors? How could we help a younger doctor perhaps to feel that they could be in a position that the first words that are spoken aren't necessarily the deepest thing in the heart of the patient? What's the difference between kind of when you walk in and you come out with an appointment for an abortion, or you walk out and you feel like you're going to get the support you need and you continue with the pregnancy? Just wondered to give a word for young doctors or anyone else who's in that position, to try to be one of the first persons to be in the position of speaking with a pregnant woman who is struggling. Dr. Jane, maybe you can go first, and then Deb. Thank you.
Right. Well, I guess usually I would say, well, how do you feel about being pregnant? Because I don't like to congratulate somebody and assume that they're happy to be pregnant, right? And then if the woman is feeling, I don't want this pregnancy, then I would just start to explore her own feelings around abortion, around the life of the baby. Does she feel, would it go against her conscience to have an abortion? Has she talked about this before? Can she imagine? I would try to imagine then the toddler, right? 2 years from now, so you can't see yourself getting through this pregnancy, but can you imagine this child as a toddler just to help her to visualize a future in which she has, in which she has actually had the baby. So sometimes it was easier before. Sometimes I would try to buy time by saying, well, let's have an ultrasound, right? Let's have an ultrasound. And then the mere act of having the ultrasound and actually having a look at a heartbeat, for example, could certainly change her mind and buy some time. Yeah, so that's sort of how I would how I would deal with it. I would say positive things about, the fact this is a new life and, coming into the world, who knows, I might joke, this child may look after you one day, which is, actually often true. Yeah, those are my comments on that scenario.
Oh, thank you very much. Thank you, Deb. Dr. Deb.
And I do, I do a combination of basically what the counselor did for the young woman that you were talking about, Martha, and what Jane does. For me, what I've learned over the years is I don't go in with direction first. I go in with connection first. I make the connection with the patient so that they know that I'm on their side. And some of them really give me a great opening. They say, well, look at you, your life is all in order. You never were in my position with an unplanned pregnancy. And I sort of smile and I say, yeah, well, I was way over my head in student debt. I was starting my internship. I'd been told by my father not to have a baby. Just because I was marrying a Catholic didn't mean I was supposed to go out and get pregnant right after I got married. And of course, our little son was born 9 months after our wedding. So, yeah. So my circumstances were not the same as theirs. Okay, and rarely are. Despite my father's comment, I did have a supportive family, and Paul's family was very supportive too. And I was at the beginning of a career where, however, I didn't have supportive colleagues. I was like you, Martha. Like, what are you going to do about this? This isn't right. So I listen. I say, well, where are you at with this? How do you feel about this? How are you feeling physically? Before you found out you were pregnant, how did you feel about being a mom? And it's amazing how many women will say, oh, I've always looked forward to having children. I just didn't plan to have it now.
Yeah.
And I say, you know what? I said the same thing. And we planned to have 6. And after my 4th, I found out I couldn't have any more. And I said, sometimes what happens to us happens for a good reason. And if you really want children, this is opportunity knocking at the door for you. I'm always surprised at how that makes women cry, like young women cry, with unplanned pregnancies. They say, oh, I hadn't looked at this pregnancy as an opportunity. And that's all about being life affirming, I guess, and offering hope and helping people see the other side of the coin. Because there definitely is one, when you got a new little life starting. And, sometimes it hasn't worked. It doesn't matter. You can talk yourself blue into the face. I can't fix the situation for the woman. And they want to fix, and the fix is having an abortion. I always let them know that they're welcomed back into practice afterwards. And I find they do come back, and some of them come back saying, don't say I told you so, but I'm depressed, I'm angry, I'm ashamed. And I never say I told you so. I would think that's really mean. Anyways, so it's listening, connecting with them on whatever level I can connect with them, you know, and to go, oh, you know, it's really difficult when you go into school and, you know, and trying to get through. That's really difficult when your colleagues don't support you. You know, wherever the connection can be made, that's where I go. And then I start looking for ways that the community or her friends or family can provide her with some support, ways that she can look at this differently, so that she can consider going on and having a pregnancy. Yeah.
Thank you both very much. And you know, this can be a back and forth at any time if either of you want to bounce back and forth with each other before the next question, okay?
Well, yeah. Yes, it just brings to mind a patient that I had. She wasn't my regular patient. One of the practices I had was actually in Toronto Community Housing Building. So I was actually going into patients' home space in a sense, their building, and they would then come and see me for medical issues. So this woman was she was a recent immigrant from Africa, and she had just found out she was pregnant, and she came to me specifically asking for an abortion. She said, I cannot tell my husband that I'm pregnant because of his reaction. We are highly in debt, and you know, and so there was some urgency. She felt she had to have this, like, she had to talk to me, and I had to arrange it right then. And I tried to make a follow-up appointment with her to think about it like a week after, but she didn't come back, right? And she never saw me again. And I felt, yeah, well, it doesn't matter how I feel, but how I did feel was that she was looking for help and she didn't get it. That's, you know, help was, the definition of help was terminating this pregnancy. I have no idea, you know, what happened to her since, if she regretted it, if they're still together. Anyway, that's often how it is, right? That's often.
Oh, yeah, absolutely. And Debbie, you said that when somebody comes back after they've had the abortion, what they get from you is, in fact, a very big heart and true compassion. Because I think the fact that you cared enough to try to say, you know, let's see if we can help you through this pregnancy, and it doesn't turn out that way, shows that you were a person who took the whole situation and her seriously. So they know that if they're feeling something serious inside of them afterwards, that you are a person who's going to not minimize what they may be struggling with afterwards. And so that's, I think, part of then being there. No matter what the outcome, we're still there.
Yeah, and you make it sound good and nice. It's really messy.
Oh,
and
yeah.
I don't want to mince words. Some women, when I don't refer for abortion. I know by the college says I'm supposed to, and that I don't have the right not to. However, I have to live by my own values, and I will, you know, and I do. And so I do not refer for abortion. I don't even refer them to somewhere where they can get an abortion. I just tell them that for me, what I offer is care, healthcare. And sometimes they get very angry and very bitter. And you know that website where they talk about how good doctor you are. I've got some terrible things, like no stars at all. They don't even give me half a star because they're mad at me and they're angry and they're upset and they've been very challenged by what I've said to them. And I think that when they feel like that, I maybe I wasn't present to them well enough. And on the other hand, I've learned to say, I can't carry this. I try and be sincere. I go in and I have a little mnemonic, which I remind myself to use all the time. And it's COAL, COAL. I get curious, so I ask questions. I observe. And I'm open to what I see. I accept them for where they're at. Lots of times they're not where I'm at. Okay, of course not. Like, They're so much younger than I am. They're in a very different position than I've ever been. Anyways, so I make sure I accept the situation for being what it is. And then I remind myself, despite my biases, despite my own feelings of sometimes frustration, I practice loving kindness. And that practice of loving kindness goes to them. And I practice loving kindness towards myself too. So when they get angry and they stalk out and they're upset with me because I won't not live my values. That sounds crazy in a negative sense. I let it go. And I say, okay, and it's not like you win some, lose some. It's not that at all. It's just the fact that I can't, I have to be loving and kind to myself, which means I set a boundary and I say, no, I can't fix this.
Right. Yes.
You got limits.
Yeah.
And that's okay. That's the
So
way.
Cole has a whole new meaning now. Thank you. Thank you both.
I was wondering if, Dr. Pritchard, you have just retired. So with that in mind, I was wondering if both of you could offer some words of wisdom for the next generation of doctor or medical student who are just beginning their journey into family practice and caring for women during pregnancies. Some wisdom or advice or a lesson that you learned that you would like to share.
Well, on the theme of being life affirming, gather a community around you, because you will need that. You will need that to withstand the pressure to bend right to the oncoming tide. So that I think could be definitely a lifeline. People in this community, others who know, who will support you when you have to, when you have to basically stand against the tide. I think that's really important, because it is overwhelming to feel that you're the only one who has this set of beliefs which are considered to be wrong-headed by most of society, apparently. So that would be my major advice for healthcare professionals who, for whom being life affirming is, a top value.
I agree with Jane. The importance of gathering a community around you, finding mentors who share your values is paramount. Okay. I was blessed to have people like Bob Baer, who is a nephrologist. You think a nephrologist is not going to be, one of those people you gather around. But he recently led a strategic planning exercise for our hospital. And I hesitated talking to him, but when I was pregnant and was suffering from considerable morning sickness, Monday morning, I spent most of my time during renal clinic throwing up in the bathroom. And I came out after about 45, maybe an hour of going back and forth to the bathroom, and found him leaning against the door. He was a big man, 6'2", broad shoulders, really a hunk in those days. Like, we've all aged, not quite so much now. And he totally blocked the door. I couldn't get around him. And he says, "Well, miss," I hate being called miss, "do you have something you want to tell me?" And I just looked at him and I said, "I'm pregnant." He said, "Oh, I thought you were hungover." Anyways, and he said, "What are you doing here, pregnant and with morning sickness?" He said, "Do you have a call room?" And I said, "Yeah." He said, "Go to bed, have a nap. Come and see me after you've had a nap." So I did. Like, an hour's nap, would always settle the morning sickness down. So I went to see him. And the first thing he did, he says, "Okay, Dr. Zeni, where we're going, you know, like I was in my, you know, like I was just a brand new doctor. And we went down and we saw the dean, and he arranged for the very first U of T medical internship paid maternity leave that ever happened in Toronto. Okay, so you're right. You surround yourself with life-affirming people. Bob Wally, which is what I put in the chat, who runs Matter Care, and that's in East Africa. Ethiopia is where he started. And he's expanded down East Africa. We were in Central Africa, in Uganda. It was Dr. Jean Chamberlain. Both Bob Wally and Jean Chamberlain have been tremendous mentors for Paul and I in our journey. We also had a faith community at our parish who continue to pray for us. And we have friends which continue to support us. And it's helpful having colleagues which will support you as well. It was wonderful having one of the most senior family docs here in Georgetown. Every time we did, we would have medical staff meetings. He would come in with a bunch of charts and he'd plug them in the middle of the table and he'd say, okay, we have to talk about these deaths. And of course, they were the charts of all the women who had had abortions. And like, it was a very bold move on his part, made everybody squirm. But he was there for us, you know? And so, yeah, it takes courage. Have a team around you and know where you stand and stand where you stand where you belong, which is with your values. It takes courage, it takes guts, and it's worth it. It will make your medical career so much more fulfilling if you live out your values and you live those out with colleagues and friends who support you and family.
Thank you both so much. This has been an honor, and sadly, I think we're going to have to end it here. To everyone who has joined us tonight, I hope that you'll be able to join us again in 2 weeks for the second I Am With You lecture on November 7th with Dr. Thomas Bouchard, who will be discussing his experiences guiding families through challenging pregnancies and perinatal palliative care. Registration is open on our website. And to everyone who has spent the evening with us, thank you. Thank you, Dr. Pritchard. Thank you, Dr. Zeni. And good night, everyone.
Thank you, Zoe, Martha, and Paul.
Thank you.
Thank you.
And thank you all for coming.